Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the iClearScope endoscope. And we have here a 15-year-old patient who has to attend every year to have their earwax and dead skin removed. And they've been having to do this since the age of 8 or 9, I believe. So it's a chronic impaction. And here we're just working on the back part of the ear canal wall, the posterior part, and they've got this thick layer of skin, and I'm trying to just elevate it off the canal wall, but I'm going to use some medical grade olive oil just to help lubricate the space that I've now created behind the dead skin and the canal wall, and also to change the consistency of this plug so it's quite sticky. And sticky wax can be quite difficult to bring away. It can also block the inside of the suction tube. So what happens if the suction tube gets blocked? And you're going to see it on a few occasions actually. So I try and come out the ear if possible and give it a little kind of shake in my hand just to help allow the suction to clear any of the blockages. Otherwise, I use a cleaning rod and I thread it through the inside of the suction tube all the way through to try and clear any internal blockages. Some people use water, so they put the suction tip in a glass of water, for example. I try and avoid water, as you all know, but also with water, that gets suctioned up by the suction tube and the hose, and it collects in a canister. And after a while, that, although we change it on a daily basis, but it can become quite odorous with water, and you've got it mixed in with earwax. So I try and avoid water for that reason. So it's quite a tricky procedure because the entrance of this patient's ear canal is quite hairy and also quite bendy and twisty. So they've got a kind of an angulation of the ear canal like that. So when we go in with the endoscope, what I'm trying to do is actually straighten that ear canal. And we do it, so this outer third is the cartilage. So I kind of go in and I push it that way to straighten it. And then it allows me to put the instrument into the ear. So it is a bit of a tricky skill when you're first learning how to perform endoscopic earwax removal, but as with anything, the more experience practice you have, it almost becomes second nature. But it's one of the things that people really struggle with an endoscope, because typically when we perform earwax removal, we use a speculum. This is one of many types, and you use the speculum instead to go into the ear and then just rotate it. And what that does, it helps to straighten and stretch open the outer third. Because the outer third of the ear canal is made up of cartilage, we're able to do that with the speculum. But with a speculum, obviously, it reduces your field of view. So, it's kind of the reason why I developed the wax scope. So it incorporates a speculum. So if someone struggles to use an endoscope, they've got a good alternative in the wax scope. So this last piece of wax is really lodged deep in their ear, and you can see I'm giving it a good wriggle and a tussle here, and slowly it's coming away, but there is, I think, another plug there behind this. And whenever you've got a patient with hairy ears at the entrance and you apply oil, something I try and avoid if possible, because the oil coats these hairs, and as you're going with the endoscope, the tip can get slightly blurred. I do try and dry out those hairs after putting drops in, but it's got this thin lacquer, so no matter how much you try and dry it up, there's always going to be some residual oil on the hairs, which can make it a bit more tricky. We can just see part of the eardrum, about a quarter. Again, this is quite large, so I'm just loosening it off the floor of the ear canal. So the angle you're seeing is around 30 degrees anti-clockwise. So it's just the way the patient's positioned, the way I'm holding the endoscope. But this ear, in reality, if a patient's upright and their head is looking straight ahead, it's kind of 30-degree clockwise to straighten it. So although it appeared to be the floor of the ear canal, was actually the back part of the ear canal. So we can see half the eardrum again, because of the angulation, the eardrum is kind of oval shaped, but in reality it's rotated about 30 degrees clockwise. So patients can quite often, when they're having the procedure performed, put their head slightly forwards. It's also the angle that I use to stretch and straighten the ear canal which just gives it this kind of appearance of being slightly off center. So yeah, the eardrum's fully visible. I'm just going to try and peel away some of this matted wax skin. I got most of it. There's a little bit there on the anterior canal wall. It was just a bit too stubborn. I did try it, but I decided to leave it in the end because I didn't want to graze the canal wall, or worse still, puncture the eardrum. It wasn't causing a problem. I did even bend it, the end of the suction, the fine end I'm using at the moment, just to see if I can get access, but it was a bit tricky, so I just left it. So the skin's quite strongly adhered, there's quite a few hairs as well. I'm just trying to pull it down. There's a bit more skin at the roof of the ear canal as well. So the last time this patient came, they've only started visiting me in the last couple of years, so this is their second visit. The first time, their ears were completely swamped with sodium bicarbonate drops, which had meant the wax became very molten and adhered to the eardrum. It was a really, really complex procedure. So on this occasion, I asked the patient not to use any drops. So previously, when they've had their ears cleaned, the specialist has always advised them to use drops, but I generally prefer my patients not to, because you run the risk of over oiling or instilling sodium bicarbonate drops, or whichever type of drops you're using, and it can make the wax really molten. Now, does drops alone clear your ears if you're full of earwax? If you've got a substantial amount of earwax, probably not, because although some drops can fragment the wax and break it down, it separates the solids from the wax from the liquids. And because when you put the drops in, you tilt your head to the side. When you then turn your head the other side, the solids still remain in the ear, they become coagulated and the liquids fall out. So, and that's what happened with this patient last time. So this procedure is far easier than on their previous occasion. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.